Hello, class, and welcome to your Chapter 13 lecture on marijuana. So the learning objectives for today's lesson are that by the end, you should be able to explain what marijuana is and why it remains so attractive and controversial. Differentiate between the effects of low and high doses of marijuana. List the potential effects marijuana use has on the body. Explain how marijuana use can become psychologically addictive. Describe how tolerance and dependence affect the response to marijuana and its use. Describe the medical uses of marijuana. Identify which age groups are most likely to use marijuana. Explain how the perceived danger of marijuana has changed with regard to high school seniors and younger age groups. And to differentiate between prior and current beliefs regarding the effects of chronic marijuana use. So in 2018, marijuana was the third most used drug, and the most common illicit drug use disorder was for marijuana. So let's take a look at marijuana's history. Well, in the 1920s, the use of marijuana began. In 1936, there was a movie, Reefer Madness, which portrayed an after-school marijuana club for high school students in suits and ties who became hallucinatory, homicidal, violent, and suicidal. In the 1960s and 70s, we had the use of marijuana increasing. 1975, Ganja in Jamaica was a book which focused its findings to refute the claim that marijuana users damage their productive capabilities. In 1978 through 1991, marijuana use began to decrease. But then we come here to 1991 to the present time, where marijuana has once again increased in use. So you see we go from the 1930s here, where Reefer Madness comes out, portraying these teens as being homicidal and violent from using marijuana, to 1975, the book Ganja in Jamaica, trying to show how its use was not impacting productivity. So what are the different types of marijuana? So marijuana consists of dried and crushed leaves, flowers, stems, and seeds of the cannabis plant. Hemp is the woody stems which yield a fiber, and it's very profitable. This fiber has been used to make cloth and rope historically. It is worth more than cultivation of both corn and wheat combined. And interestingly, California produces nearly 33% of the marijuana in the United States. So the first type we'll talk about is cannabis sativa. So the effects of this are uplifting and energetic feelings. It can help to stimulate the appetite and also provides pain relief from certain ailments. It typically grows in hotter climates, will be a brighter green in color with narrower leaves. These plants can grow between 20 and 25 feet tall, and which makes these long fibers that come from the plant great for making the rope or cloth. We then have cannabis indica, which can provide relaxation to the body as well as stress relief, a calmness or a serenity. It has also been used as a pain reliever and to treat insomnia. This plant is typically grown in warm climates and can be between 6 and 10 feet tall. It will be darker green in color with wider leaves, and it does have a lower THC content, but it has a higher THC to CBD ratio. The potency of this plant is influenced by both the climate, soil, and breeding. And our final is Cannabis ruderalis. So this possibly descends from the indica strain that adapted to the harsh climates and shorter growing seasons of the northern regions. It grows 2 feet tall at most and is more tolerant of the colder climates. It has even lower THC contents than the other two strains, but higher levels of CBD. Therefore, it is more suitable for use in clothing and textiles. So we'll get into the historical roots. So Spaniards actually brought cannabis to the Western Hemisphere. The seeds here were pressed to extract a reddish oil that was used for both medicinal as well as euphorogenic purposes. However, botanists have never been able to trace cannabis back to its very original origins. So we're going to discuss a couple different eras here where it's been known to be used in history. So our first is 2737 BC. So the first known record of marijuana use is in the Book of Drugs, which was written about this time by the Chinese Emperor Shen Nung, and he described marijuana for treating gout, malaria, gas pains, and even absent-mindedness. Then in 650 BC, we have the Assyrian record referring to this drug called azula, which was being used to make cloth and rope. 600 BC, we have these documents from 600 BC that were describing an intoxicating resin coming from this plant. In 500 BC, the Chinese were reporting that youngsters were becoming wild and disrespectful due to recreational use of this drug called Ma, or MA, which is believed to be marijuana that they were referring to. Then in the 5th century BC, we have Greek historian Herodotus, who recorded the Scythians who burned the tops of the plants, and that it produced a narcotic type smoke. And in the 1st century AD, we have a Greek physician who wrote that hemp was being made into intoxicating cakes. And also, it's worth noting that in India, marijuana has been used as an essential part of religious ceremonies. So now we'll discuss the historical use in North America specifically. So in 1611, marijuana is being used for rope, fiber, and clothes. In 1639, there was actually a law passed in Massachusetts that required every household to plant hemp seeds to meet the demand that they had for those fibers that came from the plant. In the early 1800s, U.S. physicians were using marijuana extracts to produce a tonic that was intended for medicinal as well as recreational purposes. In the early 1900s, it was brought across the U.S. borders by Mexican laborers who were seeking jobs. This caused it to spread throughout the Southwest and African American communities. And heavy marijuana users were typically from the subpopulation of jazz musicians and other bohemian types. So some artists, writers that were associated with the 1950s, what they called Beat Generation. In 1931, we have Harry Anslinger, who was first appointed head of Bureau of Narcotics and believed that marijuana was only a slight problem. But then by 1936, he said it was a great national concern and was responsible for the enforcement of marijuana laws. He actually helped set up an informational program that ultimately led to the federal law that banned marijuana. In 1937, we have the Marijuana Tax Act, which was modeled after the Harrison Act of 1914 that considered marijuana to be a narcotic, even though it was not. So it was subject to the same legal controls as cocaine and opiates. Marijuana distributors now had to register and pay taxes to be able to legally import, buy, or sell marijuana, and it was prohibited for use as an intoxicant and regulated for use as a medicine. In 1944, we have a report by the LaGuardia Committee on Marijuana, which reported that marijuana impairs intellectual functioning and lowers inhibitions, but it does not change the basic personality of the person or cause mental or physical deterioration. And then in the 1960s, use did rise greatly, and it was closely associated with the hippie counterculture. Fortunately, by 1969, we have the Marijuana Tax Act being actually deemed unconstitutional because marijuana was misclassified in this act as a narcotic. So the Marijuana Tax Act was repealed in 1969. Let's take a look now at some major factors that affect use. So we have the mass media, the role that parents play as role models, the perceived risk that an individual sees it as being. So all of these following factors we're going to discuss most directly influence the development of youth attitudes toward this drug use. So when parents have used marijuana at any point in their lives, teens are actually 40% more likely to use. Parents who have past year use, those teens are 2 times as likely to have also used during that same time period. However, when we get to here perceived risk is actually 5 times more important than parental use is at affecting whether a youth is going to use the drug or not. And we look at availability. So the drug is pretty available from friends, or you can buy it on the street. And 80% of high school seniors don't consider it as harmful. So 1 out of 15 will actually smoke nearly every day. And again, obtaining the marijuana typically relies on those informal dealings within a social network. So friends, someone you know. And then we need to look at peer pressure and influence. So the learning theory can explain how peers influence one another, who serve as role models and legitimize the use of marijuana. So they can highly influence an individual's chance of using marijuana. A few other factors that can affect use are those that are considered structural. So structural factors are age, gender, family background, and religious beliefs. You can have social and interactional, including the interpersonal relationships, friendship cliques, and drug use that happens in peer group settings. We then have the setting, which is the physical community or neighborhood that the person lives in. Personal beliefs and attitudes regarding the drug use, as well as one's self-esteem, their security or insecurity levels, and maturation. Participating in after-school activities has actually been associated with higher levels of academic achievement as well as higher levels of self-esteem. It also shows lower substance use in teens when they participate in after-school activities. So we always say in juvenile justice that the time from after school, when school lets out, until about dinner time or when parents get home from work is the highest crime time during the day. So as a probation officer, you typically don't go out to homes or you're not out in the streets between those hours. A lot of inner cities, youth are walking home from school. They might be walking home in groups. Sometimes groups of kids don't get the best ideas, and that's when crime happens. And then we also have the amount of religious involvement. So individuals who report religious beliefs that religious beliefs are important to them are typically less likely to use illicit drugs. So when we look at youth cultures, there's typically more marijuana use in those who are labeled as marginal, deviant, or rebellious groups, similar to what would have been coined the hippies during the 1960s or the burnouts during the 1980s. And burnouts, as they've been coined, are typically overrepresented in the upper middle class. They're typically rebellious within the educational system. Now, I know everyone has heard that marijuana is a gateway drug. So a gateway drug simply means that the drug serves as a gate or path that usually precedes the use of other illicit drugs, such as tobacco, marijuana, heroin, and even LSD. The question becomes, though, is marijuana actually a gateway drug, or is it just more readily available, making it precede other types of drug use, which may be harder to get? So we have a few factors here that are actually related to that progression of drug use. First, we have the peer group composition. So what is their peer group made of? Who is the group made up of? Are they using other drugs? Are they only using marijuana? Do they support or encourage the use of marijuana? Family relationships. How close is that child to their parents, to their siblings, to their extended family? Are their family members using marijuana? Are their parents using marijuana that may impact them using the drug? Their social class, so where they fall in the social ladder, and the age at which their first drug use actually begins. So most drug users will mature out of drug use, leaving behind their drug using groups and abandon drug using behavior, but there are a small percentage who do not, who will continue to progress. There are few misperceptions, though, of marijuana use. So, interestingly, parents tend to underestimate their children's use of drugs. So, 14% of parents who were interviewed thought their children would have maybe experimented with marijuana, when in reality, 38% had actually tried it. 34% of parents in that same study thought that their children may have been offered a drug, while 52% actually had been offered drugs. So parents who are more carefully and consistently monitoring their children and who maintain open communication are those who are more likely to underestimate their children's risky behaviors. They have this assumption that because they're careful, because they monitor their children and they speak openly with them, that they would tell them if they were offered drugs, that they would tell their parent if they had used drugs. But that's typically not the case. And college students also tend to overestimate their peers' use. So, a school in New Jersey, 2/3 of the students had never tried marijuana, but when the students were polled, the students believed that the average student used it about one time a week. So what are some characteristics of cannabis? Well, it can be male or female, so the plants have genders. The male plant typically dies after it's been pollinated from the female plant, and the male plant is eradicated from the growing fields so that they cannot pollinate, which increases the potency then of the female plants because they're able to take up more nutrients from the soil. They also produce more than 421 different chemicals, but THC is the primary psychoactive ingredient. So when it's crushed, the resin that is produced then is what contains the THC. The highest concentration is found in the flowering tips, as well as the upper leaves of the female plant. So the potency can actually increase, potency of THC actually increases because of our more efficient agricultural processes that we have. So THC today, potency, is 20 times higher than it was in the 1960s and 70s. The quantities of other more potent types are increasingly becoming readily available. And because drug trafficking organizations, or DTOs, are complex illegal organizations that have highly defined command and control structures that are producing, transporting, or distributing large amounts of this illicit drug. There are 4 derivatives of cannabis. First, we have sinsemilla. So this is one of the most potent, with THC contents between 9.6 and 24%. This is produced from the buds of flowering tops of the female plants, and new strains have been developed through selective breeding. The second type we have is hashish, which contains a pure form of resin from the flowers of the female plant. Domestic THC here would average about 12%, while non-domestic hashish averages about 7% of THC. Wax is then one of the most powerful and potent, so it's about 90% pure THC. It is equal to roughly 15 to 20 joints if you would smoke that many joints, and is highly hallucinogenic. So this can give intense visions and physical effects, such as passing out or even high levels of impairment. And ganja. So ganja is actually produced in India, and it is from the dried tops of the female plant. Now we'll get into electronic cigarettes and vaping, which we sort of touched on in a previous lecture. So vaping marijuana specifically has increased, especially among young adults and those in high school. So as of November 2019, the CDC has confirmed 2,290 vaping-related lung injury cases with 47 deaths. It is attractive due to its novelty and easy concealability. And there's a low perceived risk among teens. Again, you can have lung injuries and death that result. So vitamin E acetate has been identified by the CDC as a chemical of concern among people with lung injuries that's associated with using e-cigarettes or vaping. So when it is vaporized and inhaled, that's when it becomes extremely harmful to the lungs. And the concern is that we have increase in use of vaping marijuana, especially among teenagers who are growing and who are possibly harming their lungs at such young ages. Looking at synthetic marijuana, synthetic marijuana can include herbal materials that are sprayed with either one or more designer chemicals in the cannabinoid family. Some of the most widely used chemicals were scheduled by the DEA beginning in March of 2011, making both the possession and sale illegal. So synthetic marijuana, you may have heard of Spice or K2. Teens also perceive this synthetic marijuana as being a low risk, and use has been dropping dramatically since 2012 because of the DEA making some of these chemicals illegal. There are a few different methods of administration. So you can smoke the drug, vaporize, mix it with regular marijuana, or brew it as a tea. There are, however, a number of effects that can be experienced with synthetic marijuana. So the effects can be similar to that of marijuana, but can also be unpredictable and severe or even life-threatening. They can result in serious mental and physical health problems, such as a rapid heart rate, vomiting, violent behavior, and even suicidal thoughts. It can be addictive and can also cause psychotic effects, such as extreme anxiety, confusion, paranoia, and hallucinations. When we look specifically at the behavioral effects of marijuana use, we're going to talk about the high. So the high from marijuana is usually mild and short-lived, lasting about 2 to 3 hours. So the high can give euphoric and pleasant effects or states of relaxation, altered perception of space and time, impaired memory of recent events, and impaired physical coordination. A person may experience dry mouth, elevated heartbeat, some loss of coordination and their balance, slower reaction times, and a feeling of euphoria. Blood vessels in the eyes may expand, which is why you see those who smoke with bloodshot eyes, and a slightly elevated blood pressure. An acute dose can actually produce adverse reactions. So while large doses can produce confusion, amnesia, delusions, hallucinations, anxiety, and agitation, chronic doses can produce paranoia, panic disorders, fear, and dysphoria. So most frequently, this will occur in individuals who are already under stress, those who are anxious, depressed, or even borderline schizophrenic. And the person may also have difficulty with coordination, decreased muscle strength, decreased hand steadiness, postural hypotension, lethargy, decreased concentration, slower reaction times, even slurred speech, and conjunctival injection. Now, some subjective euphoric effects would include the user's altered state of consciousness, as well as his or her perceptions, which is going to depend on the set and the setting. So the subjective euphoric effects will refer to the ongoing social and psychological experiences that are incurred while being intoxicated by marijuana. This set is the individual's expectation of what the drug will do to his or her personality, while the setting is the physical and the social environment in which the drug is being consumed. Differential association theory can actually explain why marijuana enthusiasts have a strong attachment to their passionate feelings of use. So, differential association theory was developed by Edward Sutherland to explain the causes of delinquent behavior. It explains that the process by which an individual becomes socialized into the perceptions and values of a group, so that camaraderie and conversations that occur during drug use are then perceived as fun activities. So, to that end, getting high with friends is a positive reward that then solidifies the user to their friend group as well as to the drug. So, continuing on with the behavioral effects of marijuana, it can also impair the ability to perform complex tasks, such as driving a vehicle. So, it impairs motor coordination, reaction time, sensory perceptions, as well as glare recovery. So 59 subjects were in a study who smoked until they were impaired and then took a sobriety test. 94% were not able to pass the test after 90 minutes had passed, and 60% failed after 150 minutes. So heavy users may actually have increased difficulty sustaining attention, shifting their attention to meet the demands of the changes in their environment, and registering, processing, and using that information. Their perceptual functions are also significantly affected. So, drugged driving. So, drivers who consume cannabis within 3 hours of driving are actually 2 times as likely to cause an accident. Drugged driving is when an individual is operating a motor vehicle with any measurable quantity of a legal or illegal drug in the driver's body, which most often results in impaired driving. So 75% of teens actually claimed that marijuana had no impact on their driving ability. And concerning 11% of state licensed adolescents reported to drive under the influence of marijuana on 3 or more occasions. Habitual cannabis users are also 9.5 times more likely to be involved in crashes. Critical thinking skills are negatively impacted. And there's a question of let's go back to critical thinking. So related to critical thinking, one's attention, memory, learning, alertness, coordination, and reaction times may change. So heavy users have a greater difficulty sustaining and shifting their attention to meet the demands of that environment. So looking at amotivational syndrome. Amotivational syndrome refers to a belief that heavy use of marijuana causes a lack of motivation or an impaired desire and reduced productivity. The question becomes, is amotivational syndrome real, or are just unmotivated people using marijuana? So typically, these students will have lower grades in school, are more likely to be absent and not complete their assignments, or even drop out. The earlier the use begins and the heavier the use, they're more likely that amotivational characteristics will begin to show. So one study showed that college student users had higher grades, but explanations could be sociocultural, not because of the drug. In New York and New Jersey metro regions, they compared what were considered druggy schools. So druggy schools were upper middle class liberal arts schools, and boozer schools, which were your blue collar, lower middle class, sports and frat schools that had typically lower educational backgrounds. They found in the study that druggies get by easier at first, but they tend to drop to easier majors, and their grades tend to drop as their use becomes more regular. And we also had the example of in ganja in Jamaica, these users defined the drug as actually being helpful or motivating for their work. though it's important to note that most of the work they were completing was repetitive physical labor, so marijuana may have provided just a pleasant stimulation to counter the discomforts that come along with such laborious work. Now moving on to medical marijuana. Medical marijuana actually provides cannabis, primarily THC, as a drug to calm or relieve symptoms of an illness. Because medications exist, though, that are at least as effective in treating these medical conditions that don't have abuse potential, applications are typically denied by the FDA for medical marijuana treatments. Though between the 1840 and 1900s, European and American medical journals actually published more than 100 articles on the therapeutic use of the drug, then known as cannabis indica. It was actually being recommended as an appetite stimulant, a muscle relaxant, an analgesic, hypnotic, anticonvulsant, and even to treat migraines. This medical use ceased, though, when that Marijuana Tax Act was passed in 1937. So what are some other therapeutic uses of marijuana? Well, it can actually lower glaucoma-associated intraocular pressure. It may help kill or reduce the size of certain cancer cells. Can have short-term smoking improvements on breathing. And for asthma patients, because it dilates the lungs' air passages, allowing more air to come in. May also be effective at managing chronic pain, relieve muscle spasms. It also has anticonvulsant properties, so it may be effective in managing drug-resistant types of epilepsy. Treats depression from chronic stress, and has the ability to relieve intense pain from migraines, chronic headaches, or even inflammation. In South Africa, Native women actually smoke cannabis to dull the pain of childbirth. It may also relieve nausea from chemotherapy and stimulates the appetite in those who have AIDS, dementia, or other types of eating disorders. And finally, it can slow the formation of amyloid plaques in Alzheimer's and dementia patients. So these amyloid plaques actually kill brain cells and are associated with Alzheimer's. So by blocking the enzyme in the brain that makes them is how this works. There are, however, some short and long-term consequences that need to be noted. So for short-term consequences, you can have an immediate dry mouth, dry eyes, increased heart rate, and visible signs of intoxication, such as bloodshot eyes or puffy eyelids. You may have altered senses, an altered sense of time, impaired memory, changes in your mood, impaired body movement, and even difficulty thinking or doing problem solving. Some of the long-term effects, so these are effects, it may affect the brain development and may reduce thinking, memory, and learning functions, as well as affect how the brain builds connections between areas that are necessary for these functions that can last a very long time or can even be permanent. Some of the respiratory problems that can occur are persistent coughing or frequent chest colds. When we look at memory and learning, it can actually compromise the ability to learn and to remember information by impairing the ability for one to focus, sustain, and again, shift their attention, or reducing their ability to organize and integrate complex information. Can affect fertility because it suppresses the production of hormones that help regulate the reproductive system. For the mental effects, it can cause temporary hallucinations, temporary paranoia, worsening symptoms in patients with schizophrenia even. And finally, it has addictive properties. So about 9% of those who use marijuana are going to become addicted. Physical and psychological withdrawal symptoms can include irritability, restlessness, insomnia, nausea, and intense dreams, which can lead to that addictive, lead to the person becoming addicted. And then again, tolerance is going to build rapidly with this drug. Looking at some of the physiological effects of marijuana, We're going to look at how it affects a few different parts of the body. So THC actually leaves the blood very rapidly through metabolism and efficient uptake into the tissues. THC then binds to proteins in the blood and can remain stored for long periods of time in one's body fat. So even 5 days after a single dose of THC, 20% will remain stored, which is why tests show up positive even after days of non-use. Elimination of one single dose can even take up to as long as 30 days. It's rapidly absorbed into the lungs and then transported to the brain, and this happens within 14 seconds after inhalation. Then we have 3 to 4 joints per day of marijuana can actually equal 1 pack of cigarettes per day when we're talking about harmfulness to the lungs. So when we talk about these drugs staying in the body for such long periods of time, those who are on probation, if they test positive, typically you don't violate for a first positive test for marijuana. You send it out for lab results. You get those results back, so you see how many nanograms it was. You take the test again 30 days later, and the result should be that those nanogram levels are decreasing. That means that they have stopped use. So let's take a look at the brain first. So THC acts on the brain's reward system, causing a euphoric or high feeling. It stimulates the release of dopamine, which is what gives these feelings. And THC actually affects the nerve cells in parts of the brain where memory is formed, which is why your memory can be impaired after use. Additionally, overstimulation on cannabinoid receptors can alter their functioning, which leads then to the addiction and withdrawal symptoms. Talking about the central nervous system, the primary effects are going to be of THC on the CNS functions, but the precise effects are going to vary according to the set and setting that we spoke about, the route of administration, so how does the person ingest the drug, and their previous experiences with the drug. So the discovery of the cannabinoid receptor actually suggests that a selective endogenous marijuana system exists within the brain. So there's speculation that anandamide naturally works at this receptor site. So this is a fatty acid-like substance. So new therapeutic agents could potentially be developed without the harmful side effects of marijuana using this anandamide. When we talk about the respiratory system, we have the differences between smoking and vaporizing. So smoke is simply a mixture of the tiny particles that are suspended in gas, mostly carbon monoxide. Smoking cannabis produces more tar than an equal weight of tobacco. So there are more than 140 chemicals in marijuana smoke. So how we get tar is when those solid particles are going to combine to form this residue, which is considered tar. A few of those 140 chemicals found in marijuana smoke are actually proven carcinogens. Smoking can also cause respiratory problems. These include laryngitis, pharyngitis, bronchitis, asthma-like conditions, cough, hoarseness, and even a dry throat. Vaporizing then involves heating the cannabis to temperatures that release the cannabinoids in a fine mist without the toxins associated with combustion that happens when you smoke. So this can decrease those respiratory effects. Looking at effects on the cardiovascular system, it causes vasodilation and increases the heart rate. Vasodilation simply means enlarged blood vessels. So patients with heart disease, however, the increased oxygen requirement from the accelerated heart rate may have serious consequences for those types of patients. A person may feel lightheadedness or even faint from standing too quickly because of the effects on the cardiovascular system. Marijuana also limits the amount of oxygen that's able to be carried to the heart tissues, which can trigger heart attacks. So that's why in patients with heart disease, this increased oxygen requirement from the accelerated heart rate could have those serious consequences of triggering a heart attack. Marijuana also binds to hemoglobin, which limits the amount of oxygen that can be carried to the heart tissues. So in a few cases, this deficiency can trigger heart attacks. Effects then on sexual production and reproduction. So THC can sexually stimulate or destroy a sexual appetite based on the dose. So in the short term, this can have an aphrodisiac effect by decreasing CNS inhibitions and altering the perception of time, which could make the pleasurable sensations appear to last longer than they actually do. The increasing vasodilation of the genitals can also delay ejaculation. And an aphrodisiac simply refers to a compound that is believed to cause sexual arousal. There are also frequent high doses that can adversely impact spermatogenesis. This is the biological development involving the production of mature sperm cells that occurs in the male gonad of a sexually reproducing organism. However, there has been no difference found in sperm concentrations between current and former users. Heavy use can also inhibit ovulation in women. And male use does not cause birth effects to the infant, but a female who uses while pregnant can cause neurobehavioral and physical abnormalities in the fetus, as well as increase the chance of premature birth. So, in this way, the effect that it has on sexual production and reproduction is that it can alter sexual behavior, affect fertility, damage the chromosomes of germ cells, and adversely affect fetal growth and development. So it can also cause intrauterine growth retardation through increased fetal mortality, prolonged labor, which I don't think any woman would want, low birth weights, and behavioral abnormalities. Tolerance and dependence. Tolerance builds very rapidly and quickly. Frequent high doses can actually cause mild physical dependence because it causes irritability, sleep disturbances, weight loss, loss of appetite, sweating, and gastrointestinal upsets when use is abruptly stopped. Psychological dependence actually involves attachment to those euphoric effects, which are the heightened sensitivity to and distortion of sight, smell, taste, and sound, as well as to the different mood alterations that occur and diminished reaction time. A cannabis dependence diagnosis is characterized by compulsive use and hours per day that are spent acquiring and using the substance. This also includes persistent use despite knowledge of the physical problems and harms that come along with its use, or the psychological dependence we just spoke of. Chronic use, so it actually compromises cognitive functions such as short-term memory, concentration, moderately taxing problem-solving skills, and even spiritual growth and development. Heavy users will have impaired lung capacity, so it'll impair their ability to breathe properly. And those who have chronic use have a poor record for development and advancement of learning. Again, it affects numerous vital organs of your body, one being your brain, and we spoke earlier about how it affects your memory and ability to learn. It can also cause retardation in emotional development and just simply wasted time seeking the pleasures of smoking, that time that could have been spent doing other tasks that would have been more productive. So in sum, marijuana consists of the dried and crushed leaves, flowers, stems, and seeds of the cannabis plant. The three main strains include sativa, indica, and ruderalis. The four major cannabis derivatives include sinsemilla, hashish, wax, and ganja. Marijuana is attractive for its ability to relieve pain, create euphoria, as well as feelings of relaxation, stress relief, and uplifting and energetic feelings. Marijuana remains controversial for a number of reasons, including a high percentage of the US population who uses the drug. It does continue to be illegal in most states. 33 states and the District of Columbia have legalized the sale of marijuana for medical purposes, but the use and sale of marijuana in those states is illegal at the federal level. Marijuana accounts for a very large number of arrests for simple possession. It is one of the least addictive types of drugs, and most marijuana users do not graduate to other more addictive illicit drugs, despite the fact that it's been called the gateway drug. Low doses of marijuana can have a sedative effect, while at higher doses it can produce hallucinations and delusions. Marijuana also affects the body, including the brain, CNS, respiratory system, cardiovascular system, as well as the sexual organs and reproduction. Psychological dependence is going to involve that attachment to the euphoric effects, such as heightened sensitivity to and distortion of your sight, smell, taste, and sound, those mood alterations, and diminished reaction time. Tolerance to CNS and cardiovascular effects of marijuana develops very rapidly with repeated use. So while physical dependence and withdrawal are minor, psychological dependence can be significant in chronic and heavy users. THC in marijuana has been used to treat numerous medical conditions, from nausea and vomiting to anorexia, intraocular pressure, as well as an antihistamine, muscle relaxant, anti-seizure drug, antidepressant, and an analgesic. The age groups that are most likely to use marijuana are going to include adults between the ages of 18 and 25 years. High school seniors and younger age groups don't perceive vaping marijuana as risky or dangerous, though it is just as damaging to the body, and use has increased in this population over recent years. Finally, the effects of chronic marijuana use can include respiratory problems, memory and learning impairments, problems with fertility, hallucinations, paranoia, disorganized thinking, and addiction. So this was your lecture on marijuana. I hope everyone has a fabulous week, and as always, reach out if you have any questions.